We got the power and we know the way. Well, let me say a few words about the red, white, and blue. I know you're gonna do it, I believe in you.
Thank you all for coming today. I want to start off by introducing someone who is very familiar with medical care, Dr. Watson, with the Association of American Physicians and Surgeons. And then afterwards, I will introduce you to some of the people up here. And I'm State Senator Mary Fletcher Cook. And this is Dr. George Watson.
Thank you, Senator Belcher Cook. I am Dr. George Watson from Wichita, Kansas, and I'm here as president of the Association of American Physicians and Surgeons. And I'm here to help inoculate Kansans against the effects of Potomac fever. What is Potomac fever? It is the affliction that affects well-meaning representatives of both parties. Potomac fever causes swelling of the head to the point that those good people forget the citizens of their respective states who elected them, and they then vote for special interests to get reelected. With the swollen head, the formerly sane representatives pass government mandates, many of which are unconstitutional, and many are unfunded. While this proposed amendment to the Kansas Constitution will not guarantee that our federal representatives will not be infected by Potomac fever, it will protect Kansas citizens from being affected by the epidemic in Washington.
And afterwards, we will take questions too. Now, every American deserves good, high-quality health care. But there needs to be a discussion, and there's a variety of ways that we can achieve this without government coercion. The tricks today being played in Washington are not ever going to deliver us any treats. They will only deliver more tricks with ghostly promises harmful to Kansans, robbing them of their liberty to make their own health care decisions. We need to advance policies that work because they're based on natural human action, so as to safeguard our liberty, not frightening policies that force government intrusion into Kansans' lives, taking away their liberty and damaging the good health care we do have in Kansas. Kansas citizens have a right to make their own health care decisions without federal SARS. The ever-increasing encroachment of individual and states' rights by the federal government is obliterating our right as a sovereign entity for the people to best determine how to govern their state. This proposed constitutional amendment will protect Kansans so they are not at the mercy of a distant and unaccountable federal agency telling them what they must buy with their hard-earned dollars. This amendment will give Kansas citizens control to facilitate market-friendly, patient-centered, and result-driven responsible ideas. This amendment will preserve the freedom of Kansans to provide for their health care. And I want to tell you, I've been working on this with Representative Landwehr and Representative Mast, Representative Lambert is the chairman of the House of Health and Human Services, and I'll pass the mic to her.
Thank you, Mary. I think it's been a great opportunity today to travel through some of our cities and listen to everyday citizens and how they're feeling about the issue of healthcare. And there's been a great concern about what is occurring on the federal level and how it's going to impact us. And irregardless of which side that you're on, it still comes down to who should make the decision on your healthcare. Should it be government or should it be you? And so with the Kansas Healthcare Freedom Act, we feel that we will have the ability to preserve and protect the rights of individuals to make their own decisions rather than it be government. Kansans have the right to choose whether or not to join any healthcare system to preserve their freedom to be in charge of their own decisions, not government. Currently, we have many lobbies and special interest groups in Kansas and around the country that are promoting policies that would limit, or in extreme cases, eliminate the ability of people to have choices when seeking out health care for themselves or their family members. Whether healthcare solutions come from the right or the left, we want to make sure that choice remains a fundamental part and component of this ballot measure, and we feel that that's what we're doing here today. So I want to thank the people that have joined us in Wichita today, the folks that joined us in Emporia, the folks that have joined us on our bus, and those that will be joining us possibly on the bus between here and Johnson County, because these are the average citizens, and we were elected to protect the people of Kansas, and that's what we're trying to do today. So thank you. Now,
Yes, we do really appreciate everyone coming out today and showing their support, and we do welcome your questions later. I'd like to introduce the fellow legislators that are up here. Representative Lana Gordon, who's from here in Topeka, Representative Connie O'Brien, who's from Leavenworth, and Senator, used to be Representative, Senator Ralph Osmeyer from out in Grinnell, out in western Kansas. So, again, I just want to reiterate the emphasis of this bill is to protect the patient's rights to make choices for themselves. And it's also to preserve the physician's relationship with the patient so that the physician doesn't have to worry about being burdened with onerous fines and everything and have to comply with federal mandates that is actually going to limit the services they can provide. I had a physician at one of the meetings that was held down in Greenwood County recently stand up and say, "You can cut my salary, but don't try to tell me who I can treat